Hello friends, I am Dr. G.N. Goyal, Delhi based, and I am a practicing interventional pain and spine specialist. And for today's talk, let's talk about beyond my regular specialty, that is spine and pain management. As a pain specialist, I am looking after the cancer patients also. And as we know, advanced cancer patients suffering from pain and too much pain. So as we know that all of us are actually doing a lot of things for public awareness. We want the public to know about the cancer diagnosis as soon as possible. Hospitals, government, doctors, nursing homes, corporate hospitals, everybody is looking for an early diagnosis. But the hard fact is that in spite of having best diagnosis and best treatments, 70% cancer patients are suffering from advanced stage of cancer. And the most important being the pain, suffering, and in the advanced cancer stage. We all know that in advanced cancer patients, for pain management, there is a gold standard in the form of morphine and other opioids. But now, in today's world of technology and advancement in technology and techniques, we can talk about something which is way beyond this conservative management of morphine pain management. And about this morphine pain, if you talk about something beyond this morphine pain management, there are so many minimally invasive pain relief procedures that can be used, and at least in an advanced stage of cancers, patients suffering from unbearable pain, we can provide them a pain-free or with minimum pain, the life which is pain-free and full of dignity, or if not pain-free, then at least minimal level of pains till they are in this world. So coming to the point that what are these minimally invasive pain relief interventions for advanced cancer patients? We can broadly categorize in two different things. One is invasive and one is minimally invasive. So as far as minimally invasive is concerned, there are things like neurolytic blocks, radiofrequency ablations. These are the two main criteria or two main bases what we can talk about. So in radiofrequency ablation, there is the basis of radiofrequency ablation is pain interruption at various levels, right from the peripheral pain receptors to the central pain perception mechanism, that is our brain. Anywhere we can interrupt the pain with the help of either neurolysis or radiofrequency ablations. So with neurolysis we can do with alcohol, phenol, and for radiofrequency ablation we have very advanced machines, of RF machines. So now there is a general consensus is there that we keep waiting for the patients that first we try conservative management, and then when we see that conservative management is not working, and then we talk about interventions, minimally invasive pain interventions. But now the scenario is changing. We should think of these minimally invasive pain interventions in a bit early stage of advancement of disease. The reason being that these are very target specific interventions. So if the pain is localized to one part of the body, say in GI cancers, abdominal pain, in spine cancers, there's a spine pain, in other part of the body, it can be brachial neuralgia, pain covering one part, the whole upper limb, something like that. So in the early stages of advancement, if we use these interventions, we can provide patients a very good quality of pain relief. When we talk about the conservative management, of course, in the advancement of disease, when there are multiple metastases in all over the body and there are multiple sources of pain, then we need to give something which acts systemically at multiple sites. So then we should or we must give oral form of medicines or injectable medicines, preferably oral medicines that have its effect on all over the body. But in early stages, when there is single metastasis, when there is a localized advanced growth and there is a localized pain syndrome, I think interventions, they work the best. So there are neurolysis, radiofrequency ablation, and secondly, I would like to talk specifically about the spine metastasis, metastatic spine fracture, which is very, very common in cases of CA prostate, CA breast, and some other cancers. And because of this spine metastasis, they causes a spine fracture. All of us know that. And because of this spine fractures, actually the quality of life of the patient, it decreases drastically. So at least our main target, basically we have main two targets. One, the pain relief, good pain relief, and second, to improve the quality of life of the patient. And specifically, if we talk about the metastatic spine fractures, the quality of life, in addition to a severe pain, it decreases a lot. So by doing vertebroplasty or kyphoplasty, we can improve the pain levels, the pain relief levels drastically, as well as we can make the patient mobile. So all in all, we can increase the quality of life drastically. So vertebroplasty or kyphoplasty, these are two interventions again in case of spine fracture, metastasis induced spine fractures. It works fantastically. Now coming to the second part, where we can use certain implants, intrathecal implants, where we can use spinal cord stimulators, or we can use intrathecal drug delivery system, that is morphine implants. These are the two very advanced pain management systems which can actually improve the quality of life in terms of pain relief. So these are the various options which we can offer our patients to give them a good pain relief as well as good quality of life. Thank you.